I was at a powerlifting meet a few months back. I watched a powerlifter walk up to the bar. He reached down to place his hands on the bar to set himself up to deadlift. All of a sudden, he pops right back up with anguish on his face, and he grabs the back of his leg, he rips off the back brace, and he walks off the platform. Now, you don't have to be a powerlifter to hurt your hamstrings while deadlifting, or to understand the frustration of getting hurt doing something that feels like a simple move. All he did was bend down to get set up for the deadlift. Now, when you pull your hamstrings, you know at that moment you did something. You feel the pain on the back of your leg, and then the emotions come in. First, you feel angry and frustrated that your workout was interrupted. Then, the anxiety and the fear that you've permanently hurt your leg, and the idea that you might not be able to lift at the level you want any longer. Then there's a phase when all of these questions flood into your mind. Do I need to see a doctor? What if I just put ice or heat on it? Will it heal on its own? Is there a bruise? Is it swollen? How bad can it be if I can still walk? If you've been working out for a while, no matter what level, it is very likely that you've injured your hamstrings at least once while deadlifting. And many people go to the doctor only to be told to rest it or ice, which makes going back to that doctor a second time less likely. This leads to people finding other medical professionals for help, oftentimes a massage therapist or a chiropractor who can help them with their immediate pain. Fortunately, they find themselves consistently returning each time they re-pull their hamstrings. And this cycle continues no matter how often they stretch, what strengthening exercises they try. The hamstring pulls keep happening. Now, if this sounds like you and your story, you're not alone. I have worked with hundreds of athletes, weekend warriors, and people who are new to working out that have pulled their hamstrings. People like you who are trying to get back to their favorite activities without the annoyance and the worry of re-injuring their hamstrings. Now, there are 5 things that you can do that will deadlift-proof your hamstrings, and that's what we're going to talk about in this blog post. Hi, I'm Dr. Molly with Your Goals Physical Therapy, and I help active adults end their aches and pains so that they can get back to deadlifting at the level they want. So let's get started with these 5 things. First off, we're going to start with flexibility. Now, most people know that they should stretch, but they don't because it's boring. This is no different for high-level athletes or someone who is new to working out. Stretching is time-consuming and there is no immediate payoff. There is also this thought that if you're strong, you're not able to be flexible. This is a false thought, with the only caveat being, depending on your muscle mass, you may lose range for that joint, but that's not the same thing as not being flexible. Now, back to deadlifting. If your hamstrings are tight, then you bend down to grab the bar. You can stretch your hamstrings by putting them at greater risk for a tear while you're lifting. And what I mean, by this is when you place the muscle in a fully stretched position and then ask it to maximally contract, that's a disaster waiting to happen. For example, you wouldn't stretch a rubber band to its thinnest point and then pull the middle back to use it as a slingshot and not expect it to snap. This is the same idea of bending down to set up for a deadlift. If your hamstring is so tight that you're stretching it to its longest position when you set it for that deadlift, then that means you're expecting the hamstrings to lift from a compromised position. And that setup can lead to an injury whether you're lifting a pin off the floor or 1,000 pounds. So make time to stretch. It's very important. All right, number 2, strengthening. And no, I'm not talking about just strengthening your lower back. Most people think of deadlifting as only a lower back exercise. And yes, your lower back muscles do work during a deadlift. However, they should be more of a spine stabilizer, not the main mover. Deadlifting is a glute and abs dominant activity. So you should be making sure you're increasing your abdominal and your glute strength. That's right. Abs and butt, abs and butt, abs and butt. Okay. But don't stop with just those 2 body parts. Deadlifting is a full body exercise. Your upper back is key to maintaining control of that bar, not to mention trunk stability. Your feet actually help you stabilize your knees, and they prevent you from losing power as you drive the weight up. So let's make lots of time for core and a whole body strengthening program. Number 3, stability. One of the most common reasons for hamstrings and hamstring injuries is hip and lower back instability. Now, the way that instability causes a hamstring pull, it starts like this. The primary function of your ligaments is to hold the joints together. Now, if the ligaments become stretched or they're overpowered and they're no longer able to stabilize that joint, then muscles around the joint take over as joint stabilizers. And it's easy to assume that because you're stable walking around, that you would be stable lifting heavy weights. However, if the little endurance muscles and the ligaments and your lower back and pelvis are not strengthened, along with the big power muscles, then eventually the small stabilizers can't do their job and keep the bones together while you're lifting. Okay, so what that would look like in relation to deadlifts and hamstrings is if your lower back and your hip joint shifts and it causes your sits bone or the ischium to move backwards, so you get a little shift in that hip, then that sudden stretch on your hamstring will trigger your hamstrings to tighten or spasm in order to protect that pelvis and that joint from a traumatic injury. So the good news is that, like strength, stability can be improved. For example, stabilizing exercises for deadlifts would be single leg or balance activities. So try not to just train on 2 legs. Try to see what each leg can do independently. So number 4, proper mechanics. Learning and practicing the proper deadlift mechanics is important with lightweight or no weight. Your body wants to do what you ask it to do. It's a very good people pleaser. Therefore, if the goal is to lift heavier and heavier and heavier weight, often form is compromised, at least in small ways. And when you have no pain to that small mechanical change, then your body will adapt a new way of moving. Unfortunately, you will hit a breaking point. You will hit a number of reps or a weight that your body can't simply overcome by adjusting your form. This is the point where your hamstrings are now can be overstretched or overworked to the point of causing pain. So by taking the time and practicing the deadlift form without weight, you can ensure that you're maintaining the proper form as you progress your weight. By slowing down like the movement of deadlifting through, and you can feel the full range without the stress of the weight on you, then you can feel as your muscles are activating, if a muscle is tight, and that information allows you to alter your training program and get you the best results. So number 5, work with a physical therapist that specializes in educating and training deadlift mechanics. Deadlifts are an amazing functional movement. However, if you're simply trying to improve your overall health or lift an impressive weight, but they do require you to use your muscles in a way that are contrary to what we do in our modern life. Deadlifts require a lot of pelvic stability that we get from our chairs, couches, cars all day. Deadlifts also require extension of your back, your hips, and your knees, which is the opposite of the position we use with technology. So like our phones and our computers and watching TV. I point this out to show how unnatural completing a deadlift is, which is why it makes sense that you would have a difficult time figuring out how to correct your deadlift form and how to stop your hamstrings from being injured on your own. Some of these 5 things that you can do to deadlift proof your hamstrings might seem intuitive, and some of them might seem far-fetched. I get that, and I often have to show people on their own bodies how this plays out together, which I'm very happy to do since this is how I'm able to help active adults deadlift at the level they want. It is very complicated to diagnose yourself. Like whether you've seen articles on the internet or YouTube videos, it's very hard to see how all of these joints play together on your own. I can't diagnose myself. It's just very hard to do. So even with a blog as amazing as mine, where it gives you lots of good information, being able to see that on yourself is very hard to do. And this is where working with a professional is helpful. They can take away the anxiety and they can cut through all the confusion to create a clear and concise treatment plan to get you back to deadlifting without worrying about re-injuring your hamstrings. And in many cases, my clients are able to lift heavier than they were before working with me. So, if this is the type of care that you're looking for and you're ready to get started right now, feel free to click the button below that says Ask About Cost and Availability. You'll fill out a quick form and I'll call you back to answer your questions and get you started. If you've already worked with somebody and you've tried working with several professionals and you didn't get the results that you were looking for, so you're a little bit skeptical about working with me because you don't know what the difference would be, I offer a free discovery session. You're not the only one that's had bad luck in the past, so I like to have this time. It's a 20-minute session where you can ask me your questions about your injury, about how I might be able to help, maybe what the differences are. This gives us a time to meet face-to-face so that we can make sure that we're a good fit for each other.